The cholera outbreak that began in Zimbabwe in November 2008 recorded a cumulative total of over 98,000 cases and 4,288 deaths by 31 July 2009. Kadoma and Chegutu in the Mashonaland West province were two of the prioritized areas after being identified as amongst the worst affected. The Zimbabwe Red Cross Society, supported by the IFRC and with technical support from the emergency response units, reached over 1 million people throughout the country. The outbreak was a result of weakened public health and municipal services, with local authorities unable to provide adequate services, largely due to the unavailability of water treatment chemicals, irregular refuse collection and inadequate sanitation facilities, in addition to the lack of resources to repair damaged infrastructure. The national operation was scaled down in April 2009, when the cholera cases started decreasing, whilst focus was shifted to medium and long-term activities on recovery and rehabilitation. Funded by UNICEF and the EU ECHO program, the French Red Cross, working together with the Zimbabwe Red Cross and the Chegutu and Kadoma municipalities, have been carrying out these medium and long-term activities, which include rehabilitation of waterworks, training, hygiene promotion, and clean-up campaigns.
My name is Grégory Chevrel. I'm the Watson delegate for the French Red Cross. We work for humanitarian purpose, and this time, after Prince Edward, we work in Chegutu on the rehabilitation of the waterworks. The big problem in Chegutu, it was a big outbreak of cholera in 2008 and 2009. That's why the Red Cross decided to come here to support these people. Our job is mainly to produce water in quality and in quantity and to secure everything. When I say everything, is all the pumping station to be sure that the flow is going well in the waterworks and all the treatment inside the waterworks.
There's quite a lot of challenges that we have been facing as Chegutu, just like all other places in Zimbabwe, due to the harsh macroeconomic environment that we experienced. We end up in a situation where we could not replace or probably repair most of our pumping infrastructure, that is the pumps, the motors, the electrical panels. We could not repair them on time, resulting in some being obsolete, and at times we had to operate with no standbys, and during some days failing even to supply the water. We have two obstruction points, that is at the river and also at the Clifton Dam. There are some pumping units that we have there. Those at the river were actually obsolete, and those at Clifton, as much as the pumps were relatively new, we had to take some of them so that we could use them here at our waterworks. So basically the works is to replace all the pumps that are obsolete and repair those that are still repairable, like some at Clifton. Probably rewind some motors, also replace some valves, because most of our valves are not working.
We had so many organizations coming to assist in fighting the cholera outbreak. And it was during that time when it was realized that we needed to rehabilitate our waterworks so that we improve our water supplies. Actually, we have raw water, a lot of it, but taking it to the people has been the biggest problem because of aged equipment.
The main challenge was on the issue of our equipment, the pumping equipment. We actually have aged equipment such that it was unable to pump to the design capacity of the system. Also, we had a problem of the space for those few that are running. We couldn't easily get the space on the market. Some are not readily available. And also the issue of the funding. That was the other major challenge. Then we also had a problem. Yes, we do have enough raw water, but now the treatment chemicals was another major challenge. We were able to, that little water that we were able to pump, we were unable to pump it to the satisfactory conditions. Then also we have another challenge on the issue of the manpower, the skilled manpower. We do have some of the manpower, but not enough to actually do the proper treatment of the water to the residents, such that we end up having problems with people complaining about the quality of the water that we are delivering.
For the waterworks, the filtration was one of the big problems. In the different filters, they have no sand at all. That means you have no filtration. And the filtration is the last step before the chlorination, and is what ensure the quality of the water. Because if we put chlorine and your water is not very clean, it's not work well and people can continue to be sick. It's why for us, our target it was to re-put all the system of filtration completely on perfect condition. In this moment we work on it and we'll finish that in 2 or 3 weeks time. Since end of July maximum, all this job must be done.
Okay, according to our plans with the French Red Cross, by now we should be almost through. But however, we had some challenges with some suppliers. Other pumping units have already arrived, like the submersible pumps for the river, some dosing pumps for Yeta waterworks, and also some valves and gate valves repair works are in place. But however, due to the World Cup and the strike in South Africa, our major high lift pumps could not reach on time, but we expect them sometime this week. And we hope in the next 3 weeks or so, most areas will start receiving their water.
At the moment, the current status for the municipality is they don't have even an operational vehicle, and their staffs, for the waterworks in particular, they are short-staffed. So this has resulted in us going outside, like to source for labor from the volunteers, primarily from the Zimbabwe Red Cross, to just alleviate the situation. The supply of electricity to the waterworks is bad, and on average they receive around 6 hours of electricity, which is not enough to run the plant at maximum capacity.
In partnership with the French Red Cross, and we've also approached the donors UNICEF, we want them to replace our transformer. The one that we have is currently tapping off from the 11 kV line, and we want to tap off from the 33 kV line, which is not prone to load shedding. So we expect to have a 24-hour pumping period, and after the rehabilitation, we are hoping that we'll be able to produce about 16 megaliters of water, of which that will cover basically about 80% of our requirements with water reaching all places.
With the coming in of the support from UNICEF in Chegutu, we have trained hygiene promoters and we've done a CAPE survey targeting the 5,000 households that we're going to serve. And after the training, we have also been doing hygiene promotion, the messaging to the affected wards. We've identified 4 wards which were the most hard hit during the cholera period, and we are doing the promotions, hygiene promotion, household messaging, and public cleaning of the public places like toilets and other places in consultation and working hand in hand with the other stakeholders like the Ministry of Health and the Council.
Basically, what we are doing as Zimbabwe Red Cross is actually to reinforce the messages or the hygiene promotion messages that would have been done to the communities. Today, we are actually witnessing distribution of NFI kits. Firstly, we actually went into the field in Ward 11, where we actually educated the household door-to-door messages in hygiene promotion. Now, actually, to reinforce that was the information alone without material benefits cannot actually change the behavior of the people. So we are actually giving now the NFI kits, which is made up of 1 bucket, 2 kg soap, 5 strips of aqua tapes, and 3 sets of posters. So today we are actually issuing around 1,500 households, which we are going to equip them with the necessary materials that would promote hygiene in their household.
Kwakanga zvasina kumira mushe nekuti takarasikirwa nehama dzedu dzakawanda pakanga pasati pauya Red Cross, plus kuti vanhu vazhinji vanga vasati vakunyatsoziva utsanana. Saka tinotendewo Red Cross pamakauya takapiwa education yakaita kuti tikwanisewo kudzivirira chirwere chekolera.
We still have to carry out cleanup campaigns whereby we're removing rubbish from our wards, and we also have to do target group meetings in which we inform our community on the same, so that they do not continue to dump refuse and wait for the municipality to collect their bins in order to prevent dumping of rubbish in the streets.
It's a cleanup campaign that we actually carry out on every Wednesday of the week. This actually assists in the reduction of diarrheal diseases in terms of hygiene promotion. And we actually talk to the councillors and the other guys to actually make the community participate. So in each of every cleanup campaign, they actually join in the cleaning process. And as a result, when we clean all these areas, it means every rubbish and everything that we take off will actually keep the environment clean.
As our approach, we are also doing some basic training to the operators and to the waterworks operatives in the form of best practice in terms of waterworks operations.
Et donc je suis ici au Zimbabwe pour une mission qui a été mandatée par la fondation Veolia, qui vise à aider la Croix-Rouge au Zimbabwe à réhabiliter des stations de traitement d'eau, donc des missions de développement. Donc mon travail a été principalement de créer un support de formation, de donner un cours à la fois théorique et pratique sur comment fonctionne le traitement ici, qu'est-ce qu'on peut traiter, comment est-ce qu'on peut suivre les performances de l'usine en faisant des analyses labo, et comment est-ce qu'on fait la maintenance de l'usine, c'est-à-dire comment est-ce qu'on lave des filtres à sable, comment est-ce qu'on s'occupe de décanteurs, quand est-ce qu'on doit utiliser de la chaux, etc.
Veolia is the largest water company in the world. We're in every country, maybe 30,000, 40,000 employees. I traveled to Kadoma a couple weeks ago. We spent the first week doing a site visit of both plants. We looked at the incoming water quality, the water treatment that occurs at the plant, the chemical feeds, the clarifiers, and we looked at the water quality the plant was making. We trained 11 or 12 operators each day, and we did a classroom, maybe 2 to 3 hours, and discussed the plant in general, discussed the treatment that the plant does, and we discussed how the plant makes good quality water. And finally, we tested a bunch of new instruments that have been provided by French Red Cross. We calibrated them, we operated them, we let all the operators play with the instruments and try to get them a good feeling on how they worked, how to maintain them, and how to use them properly. All in all, it's going to help the operators do a better job, and it's going to help ensure that clean, safe water is made for the city of Kadoma. Continued training is going to be very important. We did a full day with the 12 operators at each plant, but for someone to come back and reinforce the use and the calibration of the instruments, the reason we do the chemical feed very precisely, and the reason we operate the clarifier and the sand filter the way we do, for that to be reinforced a couple times in the first 6 months is going to be very important.
We want to express our deep appreciation to the donors who have been very forthcoming in terms of supporting our cause. I think right from the process of preparing the relevant documentation, they have assisted us so much. The project proposals that we have put in place, and also the material, financial and human resources support that they've provided towards the rehabilitation of our water treatment plant.
We hope after when water is abundant, there will be quite an improvement in the sanitation and the lives of the people of Chegutu in general. So we would want to thank all the players that have come in, that have assisted us where we could not do it on our own.
We would like to acknowledge Zimbabwe Red Cross, the French Red Cross and UNICEF for the aid that they've been giving us.
So which means that this week that we are going to do, some people have not accessed water for more than 10 years. And we hope after this rehabilitation, there will be smiles in some people's homes.